Yeah.
So thanks so much for having me here. Very excited. And today I'm going to talk about one of the projects I've been working on with some folks at Cornell. And it's about deep survival analysis with longitudinal X-rays for COVID-19 patients. So COVID-19, I don't have to introduce COVID-19 pandemic. Unfortunately, everybody knows about that, especially here in New York City, especially at the beginning of the pandemic, March 2020. Everybody knows what happened, unfortunately, and what's happening. So let's say that we're under this pandemic at the beginning, or even now, we have a bunny, which is our patient that goes to the hospital and gets tested, and the bunny turns out to be positive. So the next step would be for a medical doctor to collect some images and some information, among others, like, for example, X-rays images, lab values, and some other social and demographic data. And if you think about any, here I'm picking COVID-19, but any medical issues and disease, when you detect a disease, you collect some information and you can ask yourself a bunch of questions. Among others, you can ask, what are the chances that a patient, for example, this bunny here, would die within the next 6, 12, or 48 hours, given their characteristics? This is important for many reasons. First of all, to understand, for example, what treatment to give or what to do next. And also it could be, so it's more like at the individual level, but it's very important, and we all know that during the COVID-19 pandemic, because we had like we had issues actually with resource allocations about ventilators and ICU beds and so on and so forth. So it's important also to know with respect to resource allocations from a hospital point of view. So this very research question, can be described and answered by using what we in biostats refer to as the survival curve. So here the example is, again, what are the chances that this person will die by 6 hours, 12 hours, and so on and so forth. So we can think of it as, again, a survival curve in which the y-axis has the survival probability. Here is just from 0.7 to 1. So at the beginning, times 0, the baseline, the person is still alive, so 100% chances to survive. And then when time goes on here on the x-axis in hours, then we have 90%, for example, probability of surviving beyond 6 hours, or 70% probability of surviving beyond 30 hours. And these are just fictional and made up numbers, nothing true. So we didn't have any bunnies, but we had real data, and we had around 1,900 patients, 19 consecutive days of data, and more than 14,000 chest X-ray studies, vital signs and other informations about patient demographics and so on and so forth during the peak of the first peak of the pandemic, March 2020 and June 2020. So I was focusing at the beginning with the time to death, but we had also other events, such as hospital admissions, ICU admissions, and ICU discharge and hospital discharge. So we focused on all of these events and the time to each of these events. So how do we come up with a curve like this one to answer the question that we were asking before? Well, we could do that through a survival model, or time to event model, which is called Cox model. The Cox model models the hazard function. So think about, again, an event, which depends on some features, X, and you think of the event happening at time T, and you want to think about the hazard. So when the chances, the intensity for which this event happens. So the Cox model turns out to be a multiplication between two main elements, the baseline hazard. So the hazard at time T, that doesn't depend on feature, that's shared across features characteristics, and then the risk function, or the exponential of the risk function, which depends on features. Okay, so this is a very well-known model, and many people use it. However, unfortunately, in our example, we have images, especially longitudinal images, And the Cox model, the traditional Cox model cannot handle images because they have high dimensionality. So unfortunately, we can't use that one. So our goal was actually to extend the Cox model to handle longitudinal X-rays and also non-image data to predict the risk of the events that I mentioned before by a specific point in time. So what did we do? Well, we simply extended the risk function. We plugged in a deep learning model that I will describe soon, and we use it, and apparently it works. So let me get a little bit more detail about what architecture we used. So our pipeline was the following. We had, as I mentioned before, lab measurements over time and X-rays over time. So we extract features from lab measurements using an RNN LSTM, and then we use a convolutional LSTM for the image feature extraction. Then we added the patient info, added everything into a fully connected layers, and then predicted our risk function. And once we had our risk function, then we could compute our Cox model, our hazard in this case, estimate that, and obtain the survival curve. So another comment for those of you that are more familiar with loss functions and more technical details, we use the Cox likelihood loss function with the F-run approximation for ties, which means that if an event happened in the same time t, then this loss function takes into account that. So some results here, we compared our method with and without images with the traditional Cox model and random survival forest and two deep learning versions of the Cox model. So as you can see, the one on the, and we compare them with respect to the concordance error, which is the proportion of events where the method incorrectly predicted A that occurred before B. So as you can see on the right here, for each of the events, hospital admissions, ICU admissions, and so on and so forth, we had the lowest concordance error, meaning that the lower the better. So we're doing good. And also we have an improvement when using images. So that's compared to not using images. That's really good. So we published this paper as a conference paper at ICCV, which is the second largest conference for vision. So we're really excited and happy about that. And of course, this is the team, very happy to collaborate with each of them. I worked mainly on the time to event part. Michele and Rachel and Charles were in charge of the modeling and the deep learning part, and Raman was the main PI. Of course, I mean, we are hungry for data. The architecture works really well, and we have many ideas on how to extend this. So if any of you have time invariant and or time varying image and non-image data, and you have a time to event endpoint, please feel free to contact me. Any of my emails here, the EDU one or Langone one, or just visit my website and contact me through that, because we'd be more than happy to collaborate with new people. The technology is agnostic to disease, so it can be applied to anything, any type of endpoints and any type of data. And with that, yeah, thank you.